Hello, I am Dr. Girish, Nelivigi, Urologist and Andrologist from Nelivigi Multispeciality and Urology Hospital in Bangalore. Welcome to my video, and today I'll be talking on an important and a common topic both in adults as well as in children. This topic is called PUJ obstruction. Now, I will divide this video into multiple parts because this is a big topic. Now let me begin by explaining what is PUJ obstruction. PUJ stands for pelvic ureteric junction. There is an obstruction between the kidney and the ureter. So the ureter is the tube which carries urine from the kidney into the urinary bladder, and pelvic ureteric junction is the junction between the kidney and the ureter. Whenever there is an obstruction at this level, there is a stagnation of urine in the kidney, and the passage of the urine into the ureter and in the bladder slows down. This causes swelling of the kidney and various symptoms. What is the cause of PUJ obstruction? The most common cause for PUJ obstruction is congenital, which means a baby is born with PUJ obstruction. When organs form in our body, not everything goes as per the plan of nature. Sometimes there could be variations and deviations. For example, instead of being born with 5 fingers, some of us have 6 fingers. So this is not a disease, but it is a variation from the script. Similarly, whenever kidneys are formed, whenever tubes are formed, for some reason, if the passage is narrow, that baby is born with that, and that causes problem. So this is an example of congenital defect, and it's called PUJ obstruction. The other less common cause of PUJ obstruction is acquired, which means to say something happens later on in life which causes blockage. Now, what are the things that cause blockage and which occur later in life? The most common is a stone in the ureter. Whenever a stone is stuck in the junction between the kidney and the ureter, and even if the stone is removed, because of the reaction and because of the damage at that point, that junction becomes narrow and causes PUJ obstruction. Similarly, there could be other causes of injury which cause narrowing, and these are the acquired causes of PUJ obstruction. Coming to the symptoms, how is a PUJ obstruction detected? The most common way to detect PUJ obstruction, especially nowadays, is by ultrasound. PUJ obstruction is detected even before the baby is born. That is, when the mother is pregnant, when an antenatal scan is done, the sonologist says that there is a swelling in the fetal kidney. And that's how the obstetrician and the pediatrician know even before the birth of the baby that there is a blockage to the pelvic ureteric junction. So after the baby is born, what is done is a series of ultrasound scans are done, because some of these PUJ obstructions, they resolve by themselves without any treatment. So a series of ultrasounds will tell us whether it is resolving, whether it is stagnant, or whether it is worsening. Depending on that, a treatment modality is advised. Typically, the baby would not have any pain, any fever, any infection. So it is detected only on ultrasound. However, a second way to diagnose PUJ obstruction is when the symptoms come. A growing baby may have pain in the kidney region, that is in the upper abdomen or in the back. Sometimes there could be urinary infections, and rarely there could be fever. When the baby is investigated, they find that there is swelling of the kidney and a diagnosis is made. In many instances, the baby grows up to be an adult without any problem at all. However, in an adult, the symptoms of pain will come up, and when an ultrasound is done, a diagnosis is made. So a defect which is there at birth may not manifest till the person is an adult. This PUJ obstruction can occur both in the males as well as in the females. It can occur in the right kidney or in the left kidney. As I told you, typically there is a pain, and sometimes the pain worsens after drinking a lot of water, because when we drink a lot of water, suddenly the urine output increases, and because of the narrowing, the urine cannot be transported from the kidney into the ureter. That's where the pain worsens. Or the adult may have sometimes urinary tract infection, sometimes fever, and that's how a diagnosis is made. Thank you for watching this video, and I'll be talking more on this disorder in the next videos.